some of the symptoms of pelvic floor dysfunction are really created by habits. So one of the things that I see in my practice is people coming in with incontinence. I don't treat incontinence. I treat pelvic floor dysfunction with the focus on pelvic instability. But I can see in my note-taking and initial consultation, I see that some of the habits that patients are having is feeding the problem. One of those habits is when they go to the bathroom, just in case. We call that jicky, just in case. So they go to the bathroom because they don't want to have incontinence. Well, their incontinence is pelvic stability issue. Granted, if the muscles inside are tight or the pelvic is tilted down or up, let's say it's tilted down, of course it's going to put pressure on the bladder and make the matters worse. But it also doesn't help that when you don't practice what your bladder is capable of, the muscles get deconditioned. Your bladder has two different types of muscles. The top portion is just like the uterus, is able to expand and get bigger, and that's because it can hold the urine. And then the bottom part is musculoskeletal, and that's when it can just kind of squeeze, like with the sphincter, just to squeeze or let go so we can urinate. So when you go to the bathroom, so often you don't practice, the nerves don't get to practice, the muscles don't get to practice what they're capable of. So of course you have pelvic instability. Additionally, you have deconditioned nerves and muscles of your bladder. So when it comes to going to a pelvic floor therapist, who can be a physical therapist, in fact, majority of pelvic floor therapists are physical therapists. They don't have to all be physical therapists. I, for one, am not a physical therapist, and yet I treat pelvic floor dysfunction. I do not go manually on the inside because I treat the house that pelvic floor is the floor of. Just wanted to bring to your attention that you are your habits, and your habits do influence your health. And this is one of those things that you should chase the why to see why the muscles inside your pelvis are too tight or too weak, why your pelvis is unstable. That's what I do. And then also see what kind of habits you're having that also complicate the case. I hope this information made sense. If you have pelvic floor dysfunction, make sure you use one of the methods of contact in the description box to contact my office. Until next time, take care.